hi, and good afternoon, and welcome to Saturday Sesh. My name is Trey Reckling, the founder and director of Academy of Cannabis Science, and it is my great pleasure to welcome our special guest today, Dr. Tim Shu. I was fortunate enough to meet Dr. Shu several years ago. When we had an incident with our pet, which we'll talk about later, but Dr. Shu really has helped to guide us, has helped to teach us, and more importantly, has been our consultant for our Pets and Cannabis class. Beyond that, in his professional life, not only is he a veterinarian, but he's the founder and CEO of VETCBD, a veterinarian formulated product, which is very unique in the space. We hope to talk about too. And Dr. Shu is not just those things, but also an educator. And I've had the pleasure of working with him to train up staffs and our staff members in California. And so Dr. Shu, and then through the class, you and I have helped to train people from all over, from Guam to now Transylvania. And so I don't know if you know that. I haven't given you an update on some of our far-flung students, but it is a pleasure to have you on today.
Thanks for having me on, Trey. Really appreciate it and excited to be here.
Absolutely. And I know that was just a thumbnail. Do you want to would you like to expound upon that intro and tell us anything else about yourself?
I think you really covered it. For me, this is one of the most exciting areas of medicine is unlocking the potential of cannabinoid therapeutics, and then on the other side of that, understanding the endocannabinoid system. So, from a medical perspective, this is absolutely fascinating. Is that we have a physiological system that's intertwined with all other body systems. So what I mean by that is the endocannabinoid system interacts with all of the body systems, whether it's the nervous system, the circulatory system, the digestive tract. It all has influence and it plays a role in the regulation of those systems. But we know so little about it. And this is something that really shouldn't be the case because we've known about the endocannabinoid system for 30 years now. But the reality is that it's still not being taught in medical schools, veterinary schools, nursing schools, and that really needs to change if we're going to be pursuing the best interests of our patients. We need to be able to unlock the secrets of that endocannabinoid system, be able to discuss it openly with the patients.
And although some people are beginning to be aware, sometimes they still haven't made that jump connection to their pets, right? And they're like, oh, well, this could affect my pet the same way or differently. And so, would you tell us a little bit about when you made that jump? Like, at what point did you say, hey, this is important enough, I need to be speaking more about it? And how tough was that as a veterinarian among other veterinarians that might not have been that out front?
Yeah, so when we're talking about cannabinoid therapeutics, traditionally it's been focused on humans. And for me, as a veterinarian, my perspective has always been that we always need to constantly be looking out for what's next. How can we improve life? How can we improve the state of medicine today? Because the way that I explain it is that how medicine is practiced today is not the way that it was practiced 50 years ago, right? If your doctor said, I learned everything I know from 1970, I didn't learn anything since then, you'd be pretty scared, right? And so the same thing applies for the future. 5 to 10 years from now, the way that medicine is going to be practiced then is going to be completely different because we're going to know a whole lot more about things like the endocannabinoid system and the role that it plays in health and disease. And so for me, if cannabis can be beneficial for humans, we really need to look and say, can it also be beneficial for animals as well? And it turns out that animals have an endocannabinoid system, just like people. It may be a little bit different, but overall, the structure is very similar. And they do stand to benefit from not just cannabinoid therapeutics, but from a further understanding of the endocannabinoid system and its role in health and disease. So for me, it just seemed a little bit silly and almost absurd that the only time that cannabis was ever mentioned in veterinary school, and I didn't graduate too long ago, but the only time it was ever mentioned was in toxicology course.
Mhm.
So, they talked about what happens when an animal gets into too much THC, but never about the potential of components like CBD or even THC. Because
Mhm.
let's be very clear here that THC does have potential therapeutic benefits. It's really about the dosing that's important. And the endocannabinoid system was not taught in school at all. And I talked to recent graduates of not just veterinary school, but also medical school. I talked to registered nurses, I talked to nurse practitioners, and I always ask them, how much about the endocannabinoid system did you learn in school? The answer is always zero. And so for me, that's the same thing as if you went to your doctor and you said, can you tell me about the endocrine system? Can you tell me about how hormones affect my body? What is the role of testosterone? What's the role of estrogen? What is insulin and what does it do? And imagine if your doctor said, I don't know anything about hormones. I don't know anything about the endocrine system. I didn't learn about it in school. We would think that that's the equivalent of malpractice because of how much the endocrine system impacts our health and wellness. It's the same thing with the endocannabinoid system. There's major impact on our health and wellness, but we still have such a rudimentary understanding. And even that basic level of understanding isn't being taught to the people that need to understand it the most.
So, considering that, how much of a challenge was this among your peer group? I mean, did you get pushback? Did you get people going, hey, don't go there yet? This is going to be, this could threaten your license, or, you could become a pariah among the community, or whatever that might be. How difficult was that to step out?
Yeah, I mean, certainly when we first started, I did get pushback, because like I said, veterinarians, their only exposure to their understanding of cannabis was through THC and through, excessively high amounts of THC. And so you saw these patients that were coming in that got into their owner's stash, that got into their owner's edibles, and were suffering from the side effects of getting way too much THC in their system. And so that was the only exposure that veterinarians had to cannabis. And so they automatically think anytime you talk about cannabis or cannabinoid therapeutics, that's the image that they have in their mind. And so there was pushback. A lot of people said, this is crazy. This is cannabis. This is not something that can be used medicinally. But I knew because of what I had seen and the benefits that I had already seen, that it was only a matter of time before they would come around because the evidence would be undeniable. And so fast forward years later, and now we're starting to see veterinarians say, hey, we really want to be able to talk about CBD. We need some legal clarification about this. We're seeing some amazing things in our clients and our patients. This needs to be accessible for animals. And so it's been amazing to see that shift in the mindset and the attitude of the veterinary community over the years.
And as far as professionally or professional organization, the AVMA is still very not real into the idea. They still aren't. Isn't it true that they still are quite restrictive about what they advise veterinarians to discuss along those lines?
Yeah, in general, you will find that organizations like that tend to be very conservative. They tend to play it on the safe side of things, and they also tend to wait for federal regulations. So that's not unexpected.
Yeah, so very much the same way the AMA is slow to come around. Um, I will say that our veterinarian, of course, living in Seattle, we're kind of in a bubble, like you are in Southern California or in California overall. Um, but recently, our vet, we said we're giving our dog CBD as needed for some skin issues. She has some allergies and she had a leg surgery. He said, well, why don't you consider giving it like a supplement, like provide it to her every day? And he said, because if you're seeing benefit, don't wait to be told that she needs it. And so that was a change for us just to hear that tone and that suggestion, from our family practitioner for her. So
Yeah, and what veterinarians should understand is that they have rights. They have free speech. It's protected by the First Amendment, and they are allowed to discuss things like cannabis and CBD. Understandably, a lot of them are still afraid to do so. That's a sign of the times, and we look forward to that changing soon because the reality is that when clients are unable to get information from their veterinarians, they're not going to stop there. They're going to find that information somewhere else, anywhere else. A lot of times it ends up going on Google, looking up things on the internet and finding out whatever they can find. But sometimes it's a matter of talking to friends and family. But regardless, what ends up happening is that they're not having that conversation with the primary source of medical information. which is their veterinarian. That's a real shame.
You mentioned THC, and so many products on the market are just CBD. And as people who are human patients or working with human patients, we know the value of the entourage effect. But could you talk about that a little bit? I know sometimes pet owners just get are very focused, or the marketing towards them is solely about that one cannabinoid. But could you talk about how that translates to pets just as well?
Yeah, so when it comes to marketing, people tend to, if they don't know the space well, they want to make it very simplified. So that's why a lot of people just solely talk about CBD. And then when you talk about the difference between full spectrum, broad spectrum, or isolate, that's when it gets incredibly complicated for the average consumer. They have no idea what the difference between something full spectrum is and what isolate is. Now, the entourage effect is the theory that when using multiple cannabinoids or multiple components of the cannabis plant in conjunction with each other, you actually get greater effect using them together than if you were to use them by themselves. And so this is what's called the entourage effect, the idea that all of the components of the cannabis plant work together synergistically to provide greater therapeutic benefit. There have been studies that have been backing this up as well. There was a study that was done in Israel looking at the use of something that was full spectrum in rats and using it for pain and inflammation. And then there was also another study in humans looking at the use of something that was full spectrum CBD versus something that was isolate CBD and using it in seizure patients as well. So they did find that the full spectrum actually had greater therapeutic benefits with fewer side effects.
Thank you. One of the things you mentioned also was about dosing. Could you talk to us a little bit about dosing guidelines? Because as I understand, from species to species, those don't necessarily stay the same. And a cat might require less than a dog, or a bird, or some other. Could you talk to us generally about guidelines to be concerned about, or things to be aware of in that space?
Yeah, it's really interesting because it's not a one size fits all situation. And what I mean by that is sometimes you can have two different animals. Say you can have two different labs. They're both 70 pounds and they may be using it for the same thing. But what you might find is that one requires a lot more than the other. And then one may only need it once a day, one may need it 3 times a day. It depends on their individual metabolism. So the metabolism of cannabinoids in different bodies can occur at different rates. And so generally what the acronym GLASS, which GLASS stands for go low and start slow. Most of the time it's used in people, but it also applies across the board in animals as well. The key to finding the right amount is using the smallest amount that provides the greatest benefit. And the way that you do that is by starting at a lower level and gradually increasing the amount. Sometimes once a day works well. Sometimes it may be up to 3 times a day. We've had some report to us that 4 times a day was work best for them. And it also depends on the situation, what you're using it for.
Now, I generally think of pets as being mostly cats and dogs, but I imagine your experience with this medicine is much broader than that. Could you talk to us about some of the other species you might have worked with?
Yeah, absolutely. So the amazing thing about the endocannabinoid system is that it's present in all vertebrate animals. And so vertebrate animals, meaning animals that have a backbone. So mammals, birds, reptiles, fish, they all have endocannabinoid systems. And because of that, they stand to potentially benefit from cannabinoid therapeutics. What's interesting is some invertebrate, meaning animals without a backbone, have also been found to have endocannabinoid systems. So there's this tiny water creature called the hydra, which is this tiny, tiny little creature that lives in the water. Even that has been found to have an endocannabinoid system. So if evolutionarily speaking, this is a system that has existed for millions and millions of years and goes way back. Even though we've only known about it for 30 years or so, it's existed for a very, very long time. Now, in terms of the different animals that we've seen benefit, it's not just dogs and cats. We've seen horses benefit as well. Horses tend to have a lot of issues that it can benefit from. We've had people use it for pigs, ferrets, birds, rats, rabbits. So there's a number of creatures out there that can benefit from it because just like people, animals can get stricken with illness. They're not free from that, unfortunately. But because of that, they are able to also benefit from cannabis.
Very cool. And I think it's important to remind people too that this is not a new thing as far as cannabinoids in veterinary medicine. In reading about herd animals in a condition called bloat, I don't know if it's called that anymore, but they used to use cannabinoid-based medicine for herd animals to prevent bloat, which I think is a GI condition, and it would save their lives. And so I don't know if you found much in the research kind of referring to what was done before Prohibition.
Yeah, unfortunately, the record keeping back in the day wasn't quite what it is today, but there is evidence that cannabis was a part of the veterinary pharmacopoeia, just like how it was in humans. Prior to the early 1900s, cannabis was recognized as medicine, not just for humans, but also for animals as well. And there's also texts that go back into the ancient civilizations that look at the potential uses of cannabis, not just in humans, but also animals as well. So it has been recognized until the age of prohibition, where everything was just kind of thrown into a black hole, and then it hasn't been until the past few decades where we've kind of had to restart that and re-recognize the benefits of cannabis.
And I credit our veterinarian with our former we had a senior dog, and she had a major stroke, and I think I found you after this. But she had had a major stroke, and I thought the symptoms that she was showing, I thought she had gotten into my infused butter, right? She couldn't stand up straight. She was urinating on herself, and we took her in, and the vet said, no, this is not cannabis intoxication. She's had a major stroke, and her brain is swollen, and she's going to die if we don't get that swelling down on her brain. He said, I'm just going to be honest with you. But he knew what I did. And he said, you might have something better than I have. I said, for real? He said, I can't tell you. I can't even guess at the dose because I don't know what you have. But you're not going to harm her with cannabis considering what she's going through. He said, we got to get the swelling down. And because of that advice, we saved her life collectively. I mean, she was back on her feet within a day and a half and lived another year and a half. I mean, she lived to be 15 and some change, but with no evidence of neurological damage, right? And so I don't know, is that a common thing, or have you seen anything similar with dogs having strokes and using cannabis for that reason?
So I'll cite a few studies that are out there. So there are some studies out there that have looked at stroke models, and they did that in rats and also in pigs. What they did was they induced stroke in those animals, and they utilized CBD in some cases before the induction of the stroke, in some cases after the stroke. What they found was that the animals that had CBD on board or afterwards actually had better recovery rates than those that didn't. So what they concluded was that there was neurological benefit to CBD. What's absolutely fascinating is that they found faster recovery times, and they found smaller infarct sizes in the animals that had CBD on board. And so the infarct size means the area that was affected by the stroke. Another really interesting study that looked at humans that were admitted to hospitals for head trauma. They looked at ones that had THC in their systems and then the ones that didn't. Now, what they found was that the ones that already had THC in their systems actually had better outcomes than the ones that did not. Now, that's not a placebo-controlled clinical trial. It's more observational data. But nonetheless, it is really interesting data because a lot of preclinical studies out there point to the neurological benefits and the neuroprotective benefits of cannabinoids.
And I'm familiar, I think I'm familiar with the study you're talking about, and the sample size of patients that they studied was huge. And I know about the time that I reached out to you for advice, I also was lucky enough to be in an audience with Dr. Ethan Russo, who some of you know, and I asked him the same thing. He said, absolutely. He said, continue to give her cannabis medicine. And he said, if I could be on the sidelines of the NFL and give those players some cannabinoid-based medicine right after they came off the field from head trauma, he said they'd be in a better state. And so I'm excited about what all we're going to learn. We know that traumatic brain injury is often a qualifying condition for patients, but I'm excited what we're going to learn just about some of that micro damage, because I know, not all brain trauma is recognized as such. So I'm excited for all of us in that line. I want to point to Don had a question about zoologists that have been working with CBD or THC. Are you familiar um, with anybody in that realm who's also doing this kind
Yeah,
of
we
work?
I've had heard a few things coming out of the woodwork here and there. One was looking at elephants and utilizing CBD in elephants, and I think I've also heard about some people looking at using it in big cats, so like the lions and tigers. But aside from that, I haven't heard too much. But it is something that's very interesting because we know that these animals have endocannabinoid systems, and there's no reason why they wouldn't be able to benefit from cannabinoids. But it's a matter of figuring out the appropriate amount for them. Certainly, I would think that an elephant is going to require much more than, say, like a bird or a rabbit.
Oh, I hope you get them as patients. I imagine you're gonna have to change your dropper, your administrating method for a big cat. But that's exciting, yeah, because just to see the help that it does for smaller animals and animals like us, why not? They hopefully will continue to explore all of these things. Could you talk to us a little bit about Vet CBD? Because your product, I do point people your way and encourage them because it is unique. I don't think there's a lot of products in the space that are veterinarian formulated. So could you talk to us a little bit about the product?
Yeah, for us, it's never been enough for me to be able to provide just the information and just the education for pet owners. It's my the approach that I've always had is that if cannabis or hemp or CBD, whatever you want to call it, can be beneficial for these pets, then we really need to be able to provide the information and the education for these pet owners to make the most informed decisions for their pet's healthcare. Now, that's only one side of it. If you say that cannabis can be potentially beneficial for their animals, and they have the follow-up question that they're always going to have is, well, how do I access it? How do I get it? And so for us, that's always been an important component of it, is that we need to provide the education from a scientific and medical lens. We need to apply the right amount of scrutiny and critical thought when it comes to this. And then on the other side, we also need to be able to provide them the means to be able to access these products, and then to be able to put in good manufacturing practices, and to be able to know that these are clean, safe materials that are able to provide consistent results for them.
And the whole thing, it's still kind of novel to me, honestly. I mean, I'm full favor, but we don't always think of our pets first. I was talking to some veterinarians at Colorado State, and they said, well, we found that we were surprised about the benefit to birds. And I don't know if it's called, correct me, is it called perch foot, but a condition with the bird's feet so they can't hold on to their perch anymore. I don't know if it was an arthritis related thing, but they said we found, because birds that would get this sort of condition, and I might be um, mistelling the story and the name of the condition, but they said birds that can't hold on to their perch often don't live very long. And they said, but the bird being able to grip again and have foot strength is, for a bird, a huge, it contributes to their health or to their illness dramatically. Have you heard
Yeah,
anything like that?
yeah, absolutely. So we have some folks that we know that have birds that have seen huge benefits from using cannabinoids. We are actually a partner with Best Friends Animal Society, and we are working with them to study the impact of cannabinoids like CBD on not just dogs and cats, but also horses, pigs, birds. They have an amazing sanctuary out in Utah where they house thousands and thousands of animals across different species. And birds, one of the things that we commonly see in birds is what's called feather picking. So when they get stressed out, they tend to pluck out all their feathers. And so one of the things that we're looking at is seeing if CBD can help ameliorate some of that stress, so that they don't feel like they're needing to pluck out all their feathers, and to help keep them calm and relaxed.
Well, I can relate. I've felt like that for the past year a little bit, and it's helped me from plucking out my feathers. I know. So, so that's fascinating, though. Could you tell us, are there any common mistakes that pet owners make, or common either mistakes or assumptions when it comes to cannabinoid-based medicine for their pets?
I think one of the biggest things is realizing that just because a product says it's hemp product does not necessarily mean that it contains any cannabinoids. So
Mhm.
this is one thing that I commonly hear is, when I talk to pet owners and I ask them if they've ever tried CBD, sometimes I'll hear that they've tried it, but they didn't find any benefits from it. And I ask a little bit more about, what kind of product they use, where did they acquire it from, and a lot of times they'll say they acquired it from a giant e-commerce platform. Now, that giant e-commerce platform actually does not allow for CBD products. What it does allow is it allows for hemp-based products that don't contain CBD. And so what find on there is you can find hemp-based products or hemp seed oil products. But if you dig a little bit more, then you'll find out that those hemp products or hemp seed oil products don't actually contain CBD. And so this is something that requires a lot of education for pet owners to understand, is that you're looking specifically for the cannabinoid content in those products. Just because it says hemp or it says hemp seed doesn't necessarily mean that it actually contains any cannabinoids. And so the way to find that out is to ask for a COA. Ask for testing that's been done on each batch of product that you're purchasing, and any company should be able to make that available. The other thing that's been found time and time again by not just the FDA, but also universities that have looked into this, is that there are products out there on the market which claim to have a specific amount of CBD, but when tested, they actually don't have that amount of CBD. In some cases, they actually don't contain any CBD at all. This is really unfortunate because people are essentially paying for something that they're not getting. And so we always encourage people that whenever you're looking at a product, go to the site and look for the COAs. And then if they don't have any, ask them to provide a COA. And really, when you're looking at a COA, it shouldn't just provide the cannabinoid profile, but you should also test for other things like pesticides and solvents, bacteria, mycotoxins, and heavy metals as well. And this should be done for each and every batch that's produced. So whichever batch that you're buying, you should have a COA that refers to that batch.
And so for people who might not be familiar, COAs meaning certificates of authenticity. So it's a real lab result, and just goes back to what we talk about human-based medicine to know your provider and make sure that you can trust your provider, because some people are just making money. Hemp seed oil, or hemp seed is rich in protein, but hemp seeds are notoriously vacant when it comes to other cannabinoids as well. And so just buyer beware, and know that there's as much grift going on in the cannabis industry ingredients as there is in the olive oil industry. When people selling extra virgin olive oil, a lot of times if you don't know any better, you're just buying the regular stuff, but you're getting upcharged. And piracy and poor practices are a thing. So I hate to say that, but you really have to find your trustworthy partners in this space. And then when you find them, you all, I hope that you're sharing that you're letting friends and family know, hey, look, this is somebody that I trust. And I know everybody on this call today, and you all are all pioneering in this space. So your opinion really does matter. So please don't be shy about those opinions. And don't be shy with your questions either. I want to make sure you all have an opportunity to ask questions. What do you have?
I'd say in just the massage community, questions that I get during my cannabis and pets are more about dosage and more about where to find the proper safe ingredients. And so I always talk about, VETCBD. I do talk about a couple of local products too, but it's not veterinary, provided or put together or formulated. But they're more, and I guess the other questions in dogs and cats are equine, because they do a lot of equine massage out here. And they're just caring about dosage mainly. So I
Yeah,
just
if
sent
they
everything to VetCBD's website, honestly.
if they have any questions, we're happy to help them. Based off of the experience that we have and what we've seen. And like I said, it's the dosing can vary. We are doing more R&D to be able to better determine the range of dosing that seems to work best for horses. But certainly, a horse's amount is going to be different than a dog or cat. But in general, the acronym GLASS, go low and start slow.
Thanks, Jen. Don, what you got?
Yeah, I was curious if there's been any types of testing on topicals on household pets.
Yeah, so we do make topicals. The question about topicals is how well they penetrate the skin. I think that's something that in the pharmaceutical industry, they know that pretty well, because the pharmaceutical industry, you can have not just well, there's topical products that are meant to stay on the skin, but there's also what's called transdermal products, products that are made to absorb through the skin and into the bloodstream. Now, when it comes to cannabis and cannabinoids, there's not as much studies out there that have looked into the transdermal potential of cannabinoids, and then also looking at regular topicals and how deeply they penetrate the tissues. There's a lot of anecdotal and observational evidence out there, but the weakest kind of evidence is the anecdotal or the observational evidence. So there is definitely potential there. We just have yet to have a better understanding of it.
Thank you. And although I didn't want to lead the conversation with what is usually taught in med school and vet school about poisoning over intoxication, I should say. Could you talk to us a little bit, because the concern is real, of course, and I know I've gotten our animal too intoxicated. Like I said, we were treating her with a human product originally, our former dog. But could you talk to us about the dangers of cannabis intoxication and how that might exhibit differently in dogs or cats or maybe other animals?
Yeah, sure. So animals tend to be more sensitive to THC. When we're talking about intoxication, we're generally talking about THC. CBD, can you take too much? I mean, certainly you can take too much of just about anything out there. You can drink too much water, and that causes hyponatremia. Breathing in 100% oxygen for extended periods of time is going to cause oxygen toxicity. Same thing with ingesting large amounts of salt. So, anything you can overdo it. And so you certainly don't want to overdo it. Remember, going low and starting slow. When it comes to THC, what happens is the THC is what's called a partial agonist of the CB1 receptors. And your brain is full of these CB1 receptors. And when you activate too much of them through THC, that's when you get intoxication. At very, very low amounts, you actually don't get intoxication. This is what's called one of the biphasic components of cannabinoids. At very low levels, you get one effect. At very high levels, you get a different effect. And animals tend to be a little bit more sensitive to things like THC, but it doesn't mean that they can't find benefit from it. The amount that's being utilized is very important, and also the formulation and the use in conjunction with other cannabinoids. But in general, you never want to leave your human products where animals can get them. And you never want to start at a very large amount and then work your way down. It's always the other way around. Start at a lower amount and gradually work your way up. But if there's ever suspicion that your animal got into your THC or got too much of something, always take them to the veterinarian. Don't second guess. Don't try to figure things out for yourself. Take them to the veterinarian. Make sure that they're in the best hands and the people that are equipped to be able to take care of them.
And I learned from you and was reminded by you again when we taught some students in California that it's not always the cannabinoids that are the greatest risk to animals when they get into edibles, but it's the additional ingredients. Could you talk about that a little bit?
Yeah, so a lot of times with human products, you have what are human safe ingredients. But just because an ingredient is safe for humans doesn't necessarily mean that it's safe for animals. So, the most common one that everyone knows is chocolate, right? Chocolate is perfectly safe for people, but dogs can't have chocolate. Same thing with other additives. One common one is xylitol. Xylitol is a sugar substitute that's used in a lot of different human products. It's used in food, it's used in chewing gum, it's used in toothpaste. You'll find it in just about everything, and when it comes to human products. But it is toxic for animals. If dogs get into xylitol, they can have serious, major complications from that. So you never want to try to give your animal human products and try to figure it out from there. There are a number of ingredients that are dangerous for them. Grapes is another one. People eat grapes all day long, but grapes are very notorious because grapes can cause kidney failure in dogs. And so we want to make sure that we're not, using any sort of human products and giving it to these animals.
And thanks for mentioning xylitol. That's also often in peanut butter, and a lot of people use peanut butter as treats or put it on bones or inside of a Kong toy or something like that. And I didn't know. I knew, grapes and chocolate. And then is it onions? Maybe sometimes for dogs can be dangerous, but I had never heard about xylitol, I think, until you told me. So thank you for that. I've heard some people even say, but my dog just really loves chocolate. I just give them a little bit. And I heard another veterinarian say, well, would you give them just a little bit of poison because you didn't think it would hurt them? We gotta help think for our pets that don't have all the information necessarily. So
Right,
thank you for
exactly.
that. Do we have other questions? Anything at all? Dr. Shu, originally, I believe you were working with one formulation that was, because it had THC in it, you couldn't sell it outside of the state. Don't you now have hemp-based products that are available outside of California? Well, outside of California.
Yeah. So we have our hemp line, and that is available to ship through the states. And we are doing R&D on other formulations as well. So there's a lot of potential with the cannabis plant that has still yet to be untapped. Everyone's currently right now focused on THC and CBD, and those are the two most well-known molecules because they're the most available and they're the most studied. But then we're also looking at other components like CBDA, THCA, CBG, CBC, CBN. There's a lot of these other components of the cannabis plant that are very interesting, that have potential, and we want to realize what their potential is.
I meant to ask you a question related to overconsumption. If an animal gets, say a dog gets too much THC, does the same logic hold like it would for a human, that CBD will help tamp that down and help? I know, like you said, always bring them to a vet, but is that some logical assumption that CBD will help assuage some of that overintoxication?
I think most of that is theoretical. A lot of that comes from humans. Humans that say that once they ingested too much THC, they use CBD to try to counteract that. I don't think that there's been any sort of strong clinical evidence that shows that. From a pharmacokinetic or a pharmacological standpoint, there's potential reasons for why that might be. But in terms of real world evidence, I don't think that we have really strong real world evidence for that just yet. It certainly may be the case, but we don't have enough evidence for that right now.
Excellent. And what are you excited about for the future of cannabinoid-based medicine for animals? Like some stuff maybe that we don't know yet, but you're excited about learning, like some of the research you've mentioned, or additional cannabinoids like you've mentioned. Is there anything that gets you excited and you kind of can't wait to see where we're going to be in 10 years?
Yeah, it's the personalization of medicine. And what I mean by that is we know that not everyone's endocannabinoid system is exactly the same. It's been shown that in humans, the certain groups have different CB1 receptors or different CB2 receptors. They're slightly different. Studies have shown that people with alterations in CB1 receptors may be more prone to certain diseases and disorders like addiction behavior or PTSD, and that genetic differences in the CB2 receptors can be associated with different things like allergy or immune disorders. And so what I would love to see is I would love for us to be able to have such a detailed understanding of an individual's endocannabinoid system that we're able to say, based off of how your endocannabinoid system is set up and what you've got going on now, this particular formulation may be best for what you're dealing with. And so that particular formulation may be, X amount of THC, Y amount of CBD, Z amount of CBG, and then potentially added in with certain terpenes or flavonoids from the cannabis plant, or other components outside of the cannabis plant, because we have to remember that the cannabis plant and the endocannabinoid system are not just two things that are completely exclusive. We may find other components outside of cannabis that have benefits and effects on the endocannabinoid system. So that's what I really want to see. Is I want to see personalized medicine for specific individuals with specific conditions, and then finding a formulation that is tailored for them.
And that is exciting. And considering all the advances we're getting genetically, it's more than just a dream, right? It's just a matter of time, it seems. And then, like you said, maybe balancing those with some synergistic herbs. I imagine we'll look back 10 or 15 years from now and recognize that we were just kind of at the beginning of a much greater understanding. So thank you for being part of our understanding today. And thank you for taking care of some of our most loved family members, the ones that often offend the least and love the most. So thanks for doing what you do.
Thanks for having me, Trey. I appreciate it.
And I'm going to put up information right after this so you can find Dr. Shu and VETCBD. It's a wonderful product, certainly focused on, like I said, the family members that you love a great deal. And do consider this type of medicine, but always do work with a veterinarian. If your veterinarian is not willing to have this conversation, reach out to Dr. Shu and explore other vets in your area who might be more willing to have the conversation, because it's a worthwhile one. Thank you all for being here today. We'll put this on YouTube so you can see it later. Please share with your friends and family who also have furry and feathered loved ones in their home.